Whilst definitions vary, the American Psychological Association defined hypnosis as a cooperative interaction in which the participant responds to suggestions of the hypnotist. That's it. No mumbo jumbo, no new age theories, just a simple, profound and evidence-based way to improve an aspect of your life that you're motivated to change. Absolutely. As far back as 1958, the American Medical Association, arguably the leading medical association in the world, certified hypnosis as a legitimate treatment tool. There is an overwhelming body of evidence that clinical hypnosis can result in positive treatment outcomes with regards to such conditions as trying to quit smoking, weight loss, phobias and anxieties, and chronic pain, to name but a few. No, you need to take that image you have of a stage hypnotist with the swirly eyes and swinging pocket watch and bin it. Clinical hypnosis is a million miles away from that popular view of stage hypnotism. I don't make people cluck like chickens. We start the session with a discussion about the area of your life that you wish to improve. The chances are that I will have been in contact with you with some preparatory information, so we normally work through that. Once we've done that, we establish some realistic goals for the treatment. Everything that I do is goal oriented so that you notice real world change when you're through with the treatment. And then we just utilise hypnosis to achieve those goals. This involves getting you really comfortable, and then we perform what is called an induction. An induction is simply a process where we get you to increasingly focus your attention on your inner world of thought, and by doing so you pay less attention to your surrounding environment. Whilst it's not absolutely necessary for hypnosis to occur, we often couple this with suggestions for you to enter a deep state of relaxation. Once you're very deeply relaxed, we use various therapeutic tools to give you healthier, new perspectives, new patterns of thinking. This is done usually through suggestions given to your subconscious, and your subconscious will always retain the ability to either accept or reject those situations. In this sense, you don't experience any loss of control. If anything, you experience a heightened sense of control, and once we're finished with the session, you'll know exactly what I mean by that. After we've performed this part of the hypnotic session, we simply reorient you to your surrounding environment, and that always feels really wonderful. We couple that with suggestions, post-hypnotic suggestions that you can approach the rest of the day with new energy. After we've performed that, the reorientation, we simply have a little debrief, which is a chat about the session, what you liked, what you maybe didn't find was so strong, so that we can tailor it in the future. And once we've done that, I normally give you some homework, which is really just some real world behavioural exercises, so that we can copper fasten the work done whilst you were in trance. In a word, it feels fantastic. As part of my extensive training, I have experienced hypnosis many times and can honestly say that during those periods I have felt a sense of clarity and relaxation that I've been able to bring through into my everyday life. Because it's such a natural experience, it will feel very familiar to you. And whilst everyone's experience is unique during hypnosis, some common reports would include feelings of very deep, perhaps overdue relaxation, a sense of clarity in thought, which you can then bring through, of course, into your everyday life, feelings of lightness and or heaviness, feelings of time standing still, or what has been described in the research as flow, and also an ability to a greatly increased imaginative capacity, which can prove to be very, very useful in terms of visualizing potentially future events, life goals, things such as that, or experiences from your past or present that you might need to work through. First of all, let me say it's a perfectly natural question to ask. I mean, who does something new without wondering, first of all, if it's safe? And the answer is that it is totally safe, and I'll tell you why. First of all, everything that you say to me is in total and absolute confidence. As a health professional with many years experience who's been trained to university level in confidentiality and medical ethics, your privacy is absolutely my number one priority. The session can be recorded if you wish. We can do this on our own state-of-the-art recording software, or you can bring your smartphone along and record it as a voice memo. This means that you can have a tailored and totally bespoke recording of your session, which you can listen to as many times as you like in the future on MP3 player or CD. We also have the facility to video record the session on a DSLR camera if you also cannot be stuck forever in hypnosis. I've heard a few people claiming that this can happen. Absolutely not. In much the same way as you can't become stuck forever in a very engrossing book. If for some drastic reason I were to get up and leave the room, you would gradually and naturally and safely return to full waking awareness in a very short period of time. You cannot be hypnotised against your own will. There's no chance that you'll spill the beans, be under my spell or lose control. It's a totally cooperative venture, and we use the chat before hypnosis to agree on realistic treatment goals, and then we're both on the same page and work together towards those. During hypnosis, your subconscious will always retain the ability to either accept or reject suggestions. And in this sense, many people have reported to me, and I have experienced this personally myself, an increased sense of self-control, because all of a sudden more options are open to you than maybe were before you came to see me. Once you've experienced hypnosis, you'll know exactly what I mean about this heightened sense of self-control and ability to see things with new, fresh perspective. The ability to experience hypnosis has nothing to do with how strong-willed you are. Once you have realised that there's an area of your life that you're motivated to change, and also any potential myths or misconceptions or resistances to hypnosis that you have been dealt with, then clinical hypnosis is definitely a sound option for you. Having the ability to realise that there's an area of our life that we wish to improve, outsourcing help to go about affecting that change in the real world, in my opinion, that's a sign of true strength of will. Let me ask you a question, since you've been asking all the questions. What do Mozart, the composer, Winston Churchill, one of the greatest British Prime Ministers, Kobe Bryant, one of the best NBA basketball players, Jack Nicklaus and Tiger Woods, arguably two of the greatest golfers of all time, Kevin Costner and Matt Damon, two Hollywood A-listers, and Jackie Onassis, the former First Lady, what do they all have in common? They've all utilised successfully hypnosis to achieve their life goals. And they're not a particularly weak-willed bunch, I'm sure you'd agree. If after watching these videos you've realised that hypnosis is indeed a sound option for you, and it's something that you want to explore so that you can make it happen, perhaps it's time that you enter the prime of your life. I'm Dr. Niall Campbell. Thanks very much for listening.